Hey, then thank you for joining.
Hey, you got it on the first right there.
Yeah, and my Wi-Fi hopefully is working better. Okay, so why don't you start off with telling us who you are and what you do, and then we can start from, and go from there.
Yeah, absolutely. First of all, thank you for hosting this. I think it's like just super important to get some of this information out there. I think that we're all so heads down, just trying to make a difference, that it's good to take a break and kind of see what everybody else is up to. My name is Ben Wei. I am one of the co-founders of A Million Masks. And what we do is that we create a crowdfunding campaign to go out and purchase and acquire N95 masks for our frontline workers. So those are doctors and nurses, in particular in the ER and the ICUs. They're really at the front line of the front lines. And as like Calvin said earlier, I've actually, we've talked to him and we want to see how we could get supply to this hospital. We've gotten supply to over 20 hospitals now in New York City. And the whole goal is, when the front line needs to be supported, right? Because if the front line isn't supported, everything else collapses. And the cardinal sin of pandemics is when healthcare workers get sick, because they're the number one resource that you can't replace. You can't just manufacture another doctor, right? You can't you can't grow another doctor. You can't just drop them in and make sure that and nurses as well. They're so vital as well. They're actually at the front lines because they're dealing with the heaviest viral load when you're intubating patients or where you're treating patients. It's the nurses there as well. So doctors, nurses, aides, they're so hard to replace. And so that's what we do. We try to make sure how can we contribute in terms of protecting them. And we start with N95s because it's the first line of defense there. And we want to solve that problem well, focus on that well before we move on.
Okay, and then I know your A Million Masks is a little bit different from PPE to NYC. You guys collect funds, and then you also figure and you try to find suppliers through different countries, right? So can you walk us through that process a little bit on how, like, from the donation process to getting the mask and then
Sure, yeah.
all the way to the hospitals?
Yeah, absolutely. When we first started, we kind of just like said, hey, look, we're a bunch of New Yorkers, right? I was born and raised here in New York, my entire life, Queens boy, born in downtown NYU Hospital, family immigrated from Taiwan and lived in Chinatown. And so like New York is close to my heart. And we just got a group of New York friends who aren't experts in this. We just happen to, one, care a lot. One of my closest friends is a doctor, an oral surgeon in the Bronx, and called me 3 weeks ago, was like, we don't have masks and we're getting infected already, like 3 weeks ago. And so we just talked, my co-founder Ginny, my co-founder Wilson, we just all as a group was like, hey, this can't happen. What can we do? And it just turns out that we were lucky enough that we had already supplies being shipped over here, because when Wuhan was having their crisis, New Yorkers actually shipped masks there, and now there's a reverse shipment, right? And so we said, okay, we found some masks. How else can we increase that supply, right? Because we're like, we just need to get more. So we launched a GoFundMe, and the GoFundMe, we thought, hey, can we raise, $5,000, maybe, it's $10,000. Oh man, I don't know. That's being a little ambitious. And so we just kind of let it go. And it kind of just took off, and it just goes to show how much New Yorkers care and how much people around the world care about what the doctors are doing. And so we like to call inside, our team, we call them masks of hope, right? Because they're actually kind of our ability to give doctors, that, hey, we, the average New Yorker, we care. And if you look at the stats on our GoFundMe, if you just go to amillionmasks.org, you'll see that, we've raised over $500,000, and from, I think, 5,000 donors. So that means the average check size is $100. That means, it's not one big, fat cat, not one big, finance person or high net worth individual coming in and writing a check. No, it's the average New Yorker. It's me, it's you, it's our friends who are like, we are stuck in our homes. We are so frustrated about what's going on. How do we send our hope there? How do we show our love there? Let us donate. And so we take that, and we take that very seriously, the fiduciary duty that comes with it. And so we have built a very extensive vetting process. So out of the labs at Alibaba, they say that 9 out of 10 masks are fake. And so we spent a lot of time saying, well, we can't use our money and buy any fake masks. How do we figure that out? And so we actually, our team has worked all weekend. They all have full-time jobs, and they built a beautiful kind of guide that says, this is all the process. These are what we check. No certifications. FDA, make sure that the factory is FDA certified. Make sure that there's fit tests and leakage tests, and there are third-party testing sites. And then all throughout the chain, we have to make sure that we're compliant, right? Because the thing is, N95 masks, you can't find them here anymore, right? And in New York, you can't even tell what's real, what's not, right? On the street price of N95s, it's easier to buy gold than it is to buy, it's probably cheaper to do that than to find N95s. And so that's why we built a supply chain. We're fortunate enough to have some knowledge within our network. And that's also, I know Plate by Plate supports kind of Asian American efforts. And I think that's kind of special, because we speak Mandarin, right? We have kind of that network. That's how business gets done in China, is that, we are known entities. We have, individuals that we've known for a long time who trust us, who are on the ground in China trying to help us, right? Help New York and help New Yorkers and help the United States. So we're lucky that we've been able to find and secure some of that supply. And so till this date, it takes a while to get stuff from China. It's that I wish it could appear. We've only been live for 2 weeks, and we've already been able to distribute 10,000 masks, and we have many more on the way. Because there is a timeline, you have to buy the masks, that you have to do, they have to produce it, they have to then put it on a plane, then the plane has to arrive, and it has to go to the factory, go to a warehouse. So it's a long process, and we understand the urgency. That's why we're so grateful for kind of everybody who's opened their wallets already. To help us acquire these masks, and there's videos that we have on our Instagram. So if you go to A Million Masks, you'll see videos of the doctors and nurses who've received these masks. And I'll be honest, very very honest, I was kind of depressed, when it first happened, when COVID-19 hit New York, because I was like, I felt hopeless, right? I felt like I'm so used to being out there and doing something. My background is in tech. And I'm like, I want to build stuff, but how am I going to fight, an invisible virus? I'm not a doctor. I'm not trained. Mm-hmm. What can I do, right? I'm just an average person. And so I was, I was playing video games that I shouldn't be playing, eating McDonald's that I shouldn't be eating. And then, when my friend said, hey, look, I think I have COVID-19. Yeah, I'm like, look, I got to do something, right? And just being able to do that, have agency in this process, has really just changed my way to live my life, right? And to say, okay, we can make some kind of impact. We can take the funds that have been we've been entrusted with, and do something with it. And then meeting those doctors who, we have videos from Elmhurst Hospital, we have videos from hospitals in the Bronx serving, very low income communities, and it breaks my heart. I haven't cried more in the past 2 weeks than I have in the past 10 years. Part of it is they share these stories. They say, like, look, I'm a nurse, my best friends are dying. 2 of my nurses are dead already in my unit because we just don't have enough PPE, and we're overwhelmed. And it's just like, it's beyond heartbreaking, right? It's beyond heartbreaking. These are the individuals who are risking their lives to save us, right? To save us, to make sure that we're safe. And we can't protect them. We can't give them N95s. Like, as Calvin said, there is a failure, and this is not the time to point fingers. We fix the crisis first. We solve that crisis first as a country unified. And then later we can talk about the politics, and later we can say whose fault it was, but we're still in the middle of it. So yeah, I'm so proud of our team, Nipa with our social media, Sambal helping us coordinate. We have a team of 20 volunteers, Jeannie, my co-founder, Wilson, our co-founder, who have just all stepped up and said they're really busy. They're New Yorkers, but they just can't sit by. So a lot of us just don't sleep. We're talking to China at like 3 a.m, trying to make sure that, is this the real Net95? Like, send us your certificates. Let's check it on the database. Mm-hmm. And we had to learn all of it. We just had to okay, what's the difference between N95 and KN95? Okay, why would customs let in one and not the other? What does no certification actually mean, and why? And it goes on and on and on. And I've been grateful for the opportunity to be able to step up and try to make some kind of action. And I'm grateful that New Yorkers have stepped up with us, mm-hmm. And we've done it together.
Okay. Yeah. So just one last question, but I wanted to just open it up to everyone to make sure if you have a question, just submit them right now on below the screen. And then I'll choose the most popular question to present to Ben. But last question from us is, how long does it take from a donation to then procuring a supplier to then have it come to New York directly, and then giving it to the frontline workers. Like all of that, there are a lot of logistics involved in that. You know, you have to get the donation, make sure you certify that the supplier is right, and then having that shipped from China to here, that's a process on its own, and a lot of shipping fees associated with that. And then also finding people available to make those deliveries. Like how long does that take, and what is the logistics behind all of that, and how are you coordinating all of that?
That's a fantastic question. So our talented volunteers actually drew up a little chart and diagram for us that shows everything from beginning from A to Z. They worked overtime, didn't sleep last night, and designed it. It will be on our website, amillionmasks.org. But I'll explain it in kind of a succinct kind of way. So we started 2 weeks ago. Donations started rolling in. And we wanted to, for me, it was my KPI, well, what we call our KPI, our key performance indicator, was how many lives can we help save? And we can only help save lives by getting, these N95s. By the way, these are the special N95s that people are talking about. Calvin, I have a pack for you. But like these are, getting these take a while, right? So we wanted to say, let's put money to work as soon as possible. And the entire world is competing for this. It's not just like us versus like a hospital. It is the government of Iran. It is the government of India. It is the government of Germany. It's everybody in the world who's trying to buy these, right? And so it's like, we just got to, whoever shows up with the money in hand gets it first. And we're lucky because we have people on the ground who are trying to put our money there first and have relationships and have procured from these factories before. So that's how we're able to do that. So after the money gets in, so a thing that very few people know, and I didn't even know, is that GoFundMe takes sometimes like 7 to 10 days, business days, to release your funds. Okay. And so we we just raised a bunch of money and we got to buy masks. What are we going to do? So actually, very generously, my co-founders and I, them more generously than me because they put up more capital than me. We spent our own money. We spent over $100,000 in debt now, waiting for the GoFundMe to clear, so that we could buy this first. So that's why we were able to get things in a timely manner. Hopefully GoFundMe, please, tomorrow we have more masks that we need to buy, and that's why we've just been waiting. We're just out of money. And waiting for liquidity to happen. So after funds, let's assume we have funds available. You have to have cash up front. It's a brand new world today, right? Before COVID-19, you could adjust terms and pay a quarter up front or something like that. Now you have to have everything, like in a sack, right? Like you guys got to show up in a briefcase full of money and be like, hey, I need you. That's the only way you're going to secure supply because it's so competitive. So you then send the money over. They then sometimes produce it. Sometimes it takes a day or two for the runs. If they have, most of these are sold out around the world now. N95s are very, very hard to get and have a very high markup. KN95s are a little more available. But so that, assuming that these are not sold out, they then have a day or two production run. Then they get shipped, and I had to learn this. There's like FOB pricing, which is not what everybody thinks. It is like free onboard pricing. And then there's like CLI, there's like different terms of shipping. And basically they put it on a plane, right? And the plane then flies over. It takes usually 4 to 7 business days to fly over. It lands here. And usually one of our volunteers generously has a warehouse that he's donated space for. Rich Chu, thank you, Rich. And he lets us kind of store our supply there. And then we have over 200 entries now for basically every hospital in New York City, and the ER and ICUs, doctors there. And we try to make sure that they're the ones who get it, because if you give it to somebody else, it might just magically disappear. So we coordinate with them. And all the major ones you can think about, we Elmhurst Hospital, like Montefiore, like New Rochelle, Montefiore, West, or Mount Sinai West, New York Presbyterian, NYU Langone. We try our best to kind of take care of their need. And we sometimes, PPE to NYC is a group who are like, okay, great, let's plug in, right? Our whole philosophy is like, you're trying to help people. If you're trying to save lives, let's work together, right? If we can get better supply, then let's all pool our resources there. Or if you can find better supply, let's pool our resources there. All we care about is getting these masks into the hands of people who need them. So yeah, that's from front to end.
Thank you. Okay, so that's the last of my question, but on the screen I have a question from Kelly's. Are you surprised by the success of your fundraising campaigns, and how do you plan to use funds to scale your operations?
Yeah. Yes, it was like I said in the beginning. We thought, like, should we ask for 10,000? That's a little much, right? And it just in less than 2 weeks we hit over $500,000, and we were just like, it was scary, honestly, because it's other people's money,
Right.
it's donor money, right? And it's like we need to be as respectful and as careful as possible because this is not my money. Respectful of that. And so one of the things we do is we make sure that the only way we spend that money is on these masks and on the delivery of those masks. And so that's how we put every cent to use. Everything else we pay out of our own pockets for, because this means a lot for us. And I mean, if you guys know of companies and corporations that Google has offered for us to do one-to-one matching for their corporate. So if you're a Google employee, go to your corporate site, you'll find a million masks under our 501c3 fiduciary Pursuit Transformation Company. You just go there, click on us, and you donate. Every dollar you donate, Google will match us another dollar. So we want to do as much of that as possible. Let's scale that, right? So we can scale our donation where it's just you, but it's your company. It's other institutions who are saying, we support New York. We support New York doctors. That's how we look at scaling. Our goal is just it's heads down, right? It's like velocity. Like we want to get masks as soon as fast as possible. And it's frustrating because it could always be faster. But we just our funds are tied up in GoFundMe. Once it's released, we'll hopefully be able to spend more. And until then, we just try to get everything as ready as possible until that is released. But the second that's released, we're spending every cent on buying these masks, buying N95s for our frontline healthcare workers.
Okay. Thank you so much for all that you're doing.
Yeah.
You, along with Mary Chen, on just collecting PPE, masks, funds, making sure that you're just normal people, right? You're just trying to help the frontline medical workers. So thank you so much for your time today to let everyone know how they can also give back. And if anyone has other questions for either Calvin, Ben, or Mary Chen, then feel free to just DM it directly to us, and then we can also make sure to pass along the message. So thank you for your time, everyone.
Yeah.
Thank you, Ben.
Yeah, you can also DM us at A Million Masks. I'll be manning it. I can answer questions and do that in real time.
Okay, thank you. All right, take care.
Thank you for setting it up.
Bye.
Thank you.